Welcome to your discussion on professional identity, the concept of professional identity from your Giddens text. We're going to be walking through your text and I'll be explaining things as we go, but please make sure that you have your textbook ready to go so that you can be looking at the text and we'll be talking through things together. And you'll also want your concept study guide to start taking notes on as we go through this topic as well. So I hope you took away from that intro video just what an incredible career nursing is and what an incredible responsibility we have to our patients, to the community. And I think in the middle of a pandemic, it really highlights the need and importance of nursing right now more than ever. So before we put you into a clinical setting where you're going to be taking care of patients and talking about medical diagnoses and what nursing care is involved in that, it's really important that we first decide what does it mean to be a nurse and to be a professional, so that when you're placed into those settings, you know just the nurses who have gone before you, the history of what you're doing, and the intention behind it as well. So as we get into this concept of professional identity, we're going to first define and describe the concept of professional identity. Now, in the bottom corner of all of your slides, you're going to see where this information is coming from. And so you'll see that this is on your Giddens, page 363. So professional identity in nursing is described as a sense of oneself that it's influenced by characteristics, norms, and values of the nursing discipline, resulting in an individual thinking, acting, and feeling like a nurse. So in other words, it's a set of beliefs, attitudes, and an understanding of who you are and what your role is as a nurse. And whether that's in the hospital setting or even as a nursing student, you know, and even when you're on vacation, you know, there's been more than once that I have been on long haul air travel and have been called to respond to emergencies in the air. I've put IVs in on a plane that was then grounded because of the sick patient. I've given pain shots hovering over the Atlantic on a guy who was on a 17-hour flight to Australia and had a shingles episode and needed a pain shot. So there's all sorts of different ways that you being a nurse plays into your life. And it's definitely more than a 9-to-5 kind of paycheck. And so I hope you get excited about that. And I'm sure many of you have a reason why you're in nursing and influences and people that have been very important in your life that were nurses and brought you to this place. So whatever it is, what your why is of why you're here is so important. And we all have one. And in class, we'll be discussing what is that why of what you do as a nurse and why you're here. So we're starting to identify with the profession of nursing. And your professional identity as a nurse is part of a larger notion of who your identity is. And so we have this identity of who we are, which includes our personal identity as well as our professional identity. And they start to kind of intertwine a bit as we grow into this identity. So how do we grow and develop our professional identity? A professional identity develops through real or simulated experiences, through reflection, and also through role modeling by colleagues. And so the way this works in nursing school is whether we're in simulation or in lab or in the clinical setting, you're going to be developing your professional identity through experience. And through reflection, I'm going to be asking you a lot in class to be journaling and reflecting on your learning and your experiences to continue developing that professional identity. And then, of course, as you go through your nursing education experience, you're going to be seeing role models both from us as the faculty, as well as, and sometimes even cooler, by the nurses in the clinical sites that you'll be seeing role modeling nursing in real life. Now, certainly identity formation at any time in our life can lead to a crisis or be a crisis, identity crisis, a midlife crisis. It can be a nursing school crisis. And many of you might be feeling that angst as part of this transition, developing into a new role, establishing new norms, learning new material, a lot of new material, right? And just be aware that all of that is very normal and it's a part of identity formation. So it doesn't always feel good, all those growing pains, but it's definitely part of you becoming a nurse. So let's go ahead and look at the attributes of professional identity. And these are the 5 things that your book highlights as attributes or criteria or parts of being a professional, having a professional identity. And so the first one your book highlights is doing. And so those are the tasks that we do. We put in IVs, we take vital signs, we give medications. Those are the things that we do. And then there's the being, and it's just who you are. It's just part of your internal understanding of self, and just, yeah, like I said, it's definitely more than just a job that you go to. It just becomes part of who you are as a person. And then certainly acting ethically means doing right. And we'll be discussing a lot of different ethical attributes and criteria as we talk about ethics this week as well. And then there's flourishing. Flourishing means growing or becoming an expert in your role. And as we get into our Davis discussion, we'll be talking about how do nurses grow in their role. And then finally, it's that changing in or settling in of an identity, which is really when you just start owning it as being a nurse. It's not just something you're learning, it's not just something you do for a job, but it's who you are as a person. Really having that settle in deeply. So I love this figure that you have on 364 because it demonstrates how as nurses, we are professionals and we're also healers. And it's this great play between the art and science of caring is really what it is. And if you're into theories, Dr. Jean Watson from Colorado is big into the science and art of nursing caring as a theory. And so this highlights just how the healer and the professional come together in a very unique role for nursing, that we're competent and committed, that we demonstrate confidentiality with our patients, that we're trustworthy. Nursing is consistently voted as one of the most trustworthy professions that there are. That we do everything that we do with integrity and with a value of a code of ethics, and that we act morally and we have responsibility to our profession. That is something that we identify with as a professional organization. Many of the chapters are going to have this theoretical links portion of your Giddens text. And for most of the time, I'm just going to ask you to skim over that briefly and not get too down into the nitty-gritty of that. It's just extremely theoretical, and I will highlight if there's any parts of that you really need to know. So for 364 theoretical links, you can just go ahead and skim through that section. So how do we grow as professionals, and how do we identify appropriate nursing and interprofessional interventions to be able to further our professional identity formation? Well, on 366, you've got a whole to-do list of ways that you can build your professional identity. So some of those include hearing expectations clearly, so knowing what is expected of you so that you can meet up to those standards. Valuing debriefing and feedback from role models. Sometimes it's not always easy to hear feedback, is it? But it is so key to what we do and to grow into that. I'll give you an example. When I was an ER nurse, and I was an ER nurse for about 12 years, I was in triage where we would see the patients as they came in before a doctor saw them, and identify how sick they were, and if they could handle waiting until it was their turn, or if they needed to be rushed back right away. And we would give patients a 1 to 5 score on how sick they were based on that using an algorithm. And I had given this little girl, she came in, she had hives all over her body. Parents weren't exactly sure what she was allergic to, but it was the only symptom she'd had, and it was for over 12 hours. And I knew that anaphylactic shock meant that you needed to have 2 or more symptoms, and we're not getting into anaphylactic shock today, so you don't have to listen to that part of it. However, the point is, she only had 1 symptom. And so I thought, she's not that sick. She'll just get some oral Benadryl and she'll be out the door. And so I gave her a triage level 4, which meant not that sick, could wait a little while and see, a nurse practitioner rather than a medical doctor. And about an hour later, the nurse practitioner from the minor care section called me back in triage and said, hey, that little girl who was covered in hives, we actually had to put an IV in her and give her IV Benadryl. So just so you know, that really should have been a triage level 3 and not a 4. And I said, oh gosh, thank you so much for the feedback, but help me understand why this should have been a 3 and not a 4, because in my reasoning, 1 symptom, so not anaphylactic, oral. And she said, well, it's just because how widespread the white hives were, we would want to treat her more carefully. And it was really good. And that's me valuing that feedback and actually asking her, why did you up her level to a 3? And so that's how I learn and grow in my profession, is continuing to ask and elicit feedback, engaging in reflection. And that can be through reflective journaling and just a reflection of your own learning, continuing to actively adopt a professional identity, being accountable, and building relationships around you. Now, professionalism starts as a nursing student. And so when we get done with this lecture, there's going to be a quick 5-minute video to watch on how nursing professionalism looks in nursing school. So I'll ask you to watch that video next. But before we get into that, I just want to touch on some of these interrelated concepts as it pertains to professional identity. Now, certainly nurses are leaders. Nurses have to communicate. Nurses communicate with family, with physicians, with each other, with handoff at shift change. Nurses have to have the sense of ethics. Again, remember, it's that one of those attributes of professional identity is doing right, is ethical behavior. And of course, we make critical thinking judgments all the time with the knowledge that we have about the patient scenarios in front of us. And so this is just one example how concepts interrelate and all play out together in real life situations. And so concepts never work in a vacuum. And as we go through your 2-year nursing training, we're going to be showing you how those concepts interrelate, so that when you are in a case with a patient, you can kind of pull in all of the different concepts that might be at play to better inform you of how to make good clinical decision-making for those situations. So there are a number of exemplars, which means examples of how this concept play out in real life nursing, on page 367 of your text. So integrity means acting consistently with purpose, meaning doing what you say you will do. Compassion is feeling what another is feeling and responding to it with the intent of doing something to help. Courage has 2 meanings: to effect change and to stand in opposition of moral rightness. Not to stand in opposition of moral rightness, to stand in opposition for moral rightness, having the courage to do what is right, even if other people are defying that. And then certainly humility means not taking either an overstated amount of credit nor blame for a particular situation. Advocacy means acting in the interest of the patient. Sometimes nurses are the last line of defense for our patients, and being able to stand up for them and to not necessarily do what we want to do for the patient, but to advocate for the patient's wishes. Care coordination is written into the scope of a nurse, and we're the only profession that has the care coordination written into our scope. And so we are coordinating care with all sorts of different interprofessionals: doctors, therapists, social workers, mid-level providers, phlebotomists, chaplains, and we have to advocate with all of those interprofessionals to make sure that the patient's wishes are being met, and that we are providing patient-centered care, meaning the patient is the driving focus of what we're doing. And finally, human flourishing, which means we not only want to prevent illness, but we want to promote wellness and help our patients and communities thrive in whatever situation they're in. Your final step for this chapter is to go ahead and read the Jane King's case study on page 368. We'll be discussing that and analyzing that in class, so please be familiar with it before we come to class.